all the same, now you can't do it.
No,
No.
I'm around about noon tomorrow. I mean today. Snob.
What do you mean, snob?
You made up your mind awfully young, it seems to me.
Well, 30's about time to make up your mind. And I'm nothing of the sort, not Mr. Connor.
All right, so we'll get started in 1 minute. All right, I'm going to pull up the slides and then we'll get started. All right, just want to make sure everyone can see. Awesome. So thank you everyone for joining us at today's event. This is ViTAL's Leaders in Healthcare series. Essentially, this is a virtual fireside chat. While we wish it would be in person, we can't really do it at the moment. I would like to kind of preface this event by saying that we really only have an hour, so we're hoping to have an extremely dynamic and informative conversation. But given that time limitation, we're not going to be able to touch on all the small details of topics we talk about. And so that we hope you kind of leave this event with more questions than answers. And that you're kind of inspired to maybe do some digging yourself into the topics which have piqued your interest. And then who knows, maybe in the near future, you'll start your company or like our speaker, Mr. Nagpal, you'll start your first of many companies. And yeah, just a little quick blurb about ViTAL. So the name ViTAL kind of embodies our mission to essentially empower the eye. So the impact each individual can make in healthcare. That sounds kind of cheesy, but what we try to do as a club through our goals of inspiring, connecting, and eventually creating is to kind of show all of us Northeastern students that there are so many things we can do in the healthcare field, and whatever kind of piques your interest and whatever like passion you have, you can kind of explore that, and eventually, if you explore it to its fullest extent, you can really drive healthcare forward and make a difference. And yeah, so we're an interdisciplinary collaborative of Northeastern students united around healthcare innovation, going together to develop in knowledge, connections, and skills outside the classroom. That doesn't mean we force each other to innovate. It doesn't mean we force each other to be entrepreneurs, but we like to shed light on that healthcare innovation space, specifically in the Boston area. And lastly, we're open to students of all backgrounds. Um, but mostly Northeastern students for the events that are only open to us. And so with that, I just wanted to give a little preface. So our Leaders in Healthcare series was created to highlight individuals in the healthcare space with a proven track record of innovating and leading. And so today we are honored to be hosting Mr. Sumit Nagpal, a serial healthcare entrepreneur with 30 plus years experience in the field, who is the current CEO and co-founder of Cherish Health. Mr. Nagpal, thank you for taking the time out of your Thursday night to speak with us.
It's my pleasure. Thank you for inviting me to speak with your group. I love your mission, and at some point, I'd love to understand what inspired you to focus on healthcare. But we can do that at another moment.
Sure, yeah. I guess that's a great segue to my first question, which is me asking you, what led you to focus on healthcare?
Well, I grew up in healthcare is the best way to answer that question. I grew up in India. My family, while I was growing up, owned a company. That's where the beginnings of my wanting to be an entrepreneur came from. My dad's a doctor, but he's also a public health expert. He went to Harvard, got his MPH there. He's also studied architecture. He's the classic underachiever, and he started this company that I grew up with that designed, built, equipped, staffed, operated hospitals throughout that part of the world into the Middle East. Beautiful hospital in the Maldives Islands that they built. Hospitals that go into Southeast Asia as well, and I grew up with that. In many ways, what happens in these institutions is just intuitive to me. And this is not just hospital; it's also primary care. It's village clinics. It's care in non-traditional settings. If I hadn't found this passion for computing, I'd be a doctor. Fortunately, I found a different passion, and I decided to put the two together into my career. I used to say that I'm one of those crazy people who feels very, very comfortable, in fact, just at home in a very busy emergency room late at night, just watching people do their work and learning from how they're working. I used to do that in my previous companies as we built tools for doctors. It was home. But over time, I've now moved into a different way of thinking about healthcare, and I hope we'll talk about that sooner rather than later in this call as well.
Yes, yeah.
I hope that gives you some perspective.
Yes, yeah, and it helps a lot of our members who may be pre-med, so who are pursuing that side of healthcare as well. So yeah, going into your experiences, so a lot of them seem to revolve around healthcare data, sharing, accessibility, and you founded your company, your first company. It was, some would say it was kind of ahead of the game at that point as well. So can you kind of talk about how your interest in that realm of healthcare data started? I'm assuming it started through your computing software interests, but yeah, if you could just kind of speak on that.
Yeah, that's exactly where it started. I was at Brown, and I walked into the computer science lab one day, and every Sun workstation had been replaced by these beautiful black machines from Next. It was love at first sight. I had to work for the man, and I wound up working very closely with Next, working directly with Steve in the early 90s. That got me hooked on computing. The other thing that it did was got me hooked on being an entrepreneur. That was it. It was kind of done. And at some point, I just had to go start my own company. Well, picking healthcare was logical. And then in healthcare, the problem that I had been wanting to solve for the longest time. This is actually really interesting. I'll tell you a little story. When I was in India, I flew to Singapore at one point to visit a very large global company that wanted to show us I was working for my dad's company at that point. Wanted to show us. This was in sometime in the 80s, maybe, or early 90s. They wanted to show us this very exciting digital technology that they were working on. And I remember watching this movie that they had built that described the vision of the future. They called it Healthcare 2000. And the vision was about this ubiquitous flow of information about people. They told a story about a girl who ate something and how researchers were pulled together from around the world to figure out why whatever symptoms she was feeling, where were they coming from? And then somebody remembered that she'd eaten these mushrooms, and they found the expert on mushrooms in some other part of the world. And long story short, medical records were flying around, and people were collaborating by video. This was in the early 90s, right? We didn't have the internet back then, but they had painted this beautiful picture, and it was all about data. It was all about this person was at the center of everything that was happening, and everyone knew what was happening with her, and they were all collaborating around her data. And the reality of the world at that point was that A, everything was on paper, and B, there was no collaboration. Everything happened in these silos, right? You went and saw the doctor, and your record started and ended with that episode, that visit. When you were in a hospital, your hospitalization started and ended with that episode. Fast forward, 30 years, it still works the same way. But what got me inspired back then was, a little bit of that video, a little bit of what I grew up watching and seeing, a little bit of what I saw, someone like Steve make these big, bold, grand, visionary attempts at changing an industry. And data was where I thought, if we could free this data, if we could actually liberate it in electronic digital means, that we could actually cause that kind of collaboration to happen, that we could actually deliver personalized care, that we could actually not cause harm while delivering care. That was the beginning of what I got into this in the first place. Just being able to treat people more safely is what got me interested. And that meant knowing what their medications were, knowing what they were allergic to, knowing, that you were going to actually operate on the right foot, not the left foot. All that stuff was what got me into figuring out how to get data moving around. Hope that painted the picture for at least what got me interested in data. Now, long, story beyond that, which I think some of your other questions will probably cover.
Yeah, that's awesome. Yeah, it's interesting they said healthcare 2000, right? It's already healthcare 2021. So
Yep. And we still haven't achieved that vision, by the way, right? I built a prototype in 2003 at one of my companies. I still have that prototype. There's less than 20% of the vision that we laid out in that prototype that exists in the world today, right? It's still not. This industry is still really, really far behind, and it moves at a glacial pace.
Yeah, and I guess that transitions to the second part of this question is, so for some of us who don't really have that technical background, and we hear about this healthcare data, just this whole topic, right? Either through being in the clinic or just reading about it. What is exactly like your view of the reason why there's so much controversy and like complaining about the healthcare data system, which essentially like it's not going to be perfect, right? Nothing's perfect, but it just seems like one of those things where you hear more bad things than good.
There's so many places to start answering that question. So I'll come at it from a couple of different angles. Number one, it's all about the types of companies that have chosen to be in this industry that have then entrenched themselves by building walls rather than by building bridges, right? So healthcare technology companies, especially those that focus on medical records, have taken a win-lose approach to their businesses. They They have sought world dominance. They have sought to own every piece of every department in their client organizations. And being able to interoperate with somebody else means that a customer can choose best of breed or best of class, or assemble an infrastructure by picking the things that make the most sense for their business. And that's not good business for a company that wants to dominate an entire industry, right? So what has happened is that these companies have built barriers to that kind of collaborative integration. You would not get away with that with a consumer product. You would not get away with that in many other industries. And yet in healthcare, because of the types of vendors that have come in. And then the second piece is the incentives of the organizations that they serve, right? Those organizations are similarly insular. For them, it's a zero-sum game in many, many cases where, if somebody else gets easy access to the data of a patient, they'll steal the patient. That's the fear. Or a patient can go get care someplace else where it might be more convenient or more accessible or cheaper, or et cetera, et cetera. And, that's bad business for these organizations that think that that's bad business. Most of the world doesn't think that that's bad business. And most consumers, if they had a choice, would call that good business. But these organizations tend to be insular. Healthcare is one of those last remaining industries. This is the heart of it. Healthcare is one of those last remaining industries where the consumer of the product, the patient, or that individual who's got a chronic condition and is trying to manage it, or that individual who's got a sudden need for something and is trying to get help. This is one of those last remaining industries where that individual has no power, no control, no choice about where they're going to get that service. Their employer's health plan determines where they get to go, and their employer's health plan determines what that service provider gets paid, et cetera, et cetera. It's an industry that is built on very lopsided relationships. The consumer doesn't get to choose. And when the consumer doesn't get to choose, it's like all other social systems and economic systems that we have built as human beings. When people don't get to actually make choices based on their preferences, based on assessment of the qualities of various things, when consumers don't get to do that, everything falls apart. It's really that simple. And that's the challenge with healthcare.
And so have you, through your many companies, could you list some, essentially through your companies, have you tried to solve that issue of giving the consumers a choice?
Well, so incrementally, every company that I've built, that has been a key part of what we've tried to solve. Every single company we've tried to focus on, how do you break down the barriers that prevent people from making choices about the care they're receiving, and that prevent doctors from being able to make informed decisions, right? It goes both ways. It's not like doctors wake up every morning wanting to build barriers or practice, insular, localized medicine for their patients. They want to help their patients have as much of a chance at the right treatment as possible. And information is a key ingredient to all of that. But the organization, the incentives structures that they work within get in the way. And so literally every single company, when we started off in the early days with just opening up access to data, then we moved into being able to enable people to reach into organizations to receive remote health, remote care, telecare. We were doing video-based telecare, teleconsultations between the Mayo Clinic and patients in Abu Dhabi in the mid-90s before the internet. But that was all about access. That was all about opening up options and choices for patients to be able to get the best care that they could find in the world. And then opening up, being able to figure out if a medication being prescribed at the point of care is going to cost too much and harm a patient. Knowing what medications that patient is on is a really important part of that puzzle. Making that available at the point of care so that a doctor can make informed decisions, not just financial good decisions, prescribing a medication that is the lowest cost, also good decisions for the patient where out-of-pocket costs are managed, but safe decisions, right? So yes, every step of the way we've tried to do that. Now, this company number 5, Cherish Health, is like the ultimate expression of that journey, where our entire approach, we've actually said healthcare as it exists today will not adopt the kinds of things that people who are growing old, wanting to live independently, need care, need proactive care before they wind up in ambulances, in emergency rooms, receive that care while they're still at home so that those experiences are prevented. We don't think that those incentives have changed really, right? So we've said, let's flip the model. Let's actually take this directly to those consumers. So to answer your question, yes, every company has done progressively more and more to achieve this consumer empowerment, this consumer engagement.
Awesome. And going off of that, I think I did some research. I feel like your time at Comcast was revolving around that as well. And so at ViTAL, we're really about non-traditional paths in healthcare. So can you kind of talk about your time working for Comcast?
Sure. It was during a period where in the most pleasant terms, I described that as my sabbatical. I was taking a break from building companies. I joined initially as the global lead for digital health at Accenture. Dream job. Most people call that their career. It's a job to die for, and I had a great time. And Comcast became a client, and then Comcast hired me to help build their healthcare business. But really, my DNA is I'm a company builder, and I'm a builder of technology. And the place that happens, and this is nothing to do with Comcast or anybody else, the place that happens most effectively is in small, tightly knit groups that are, in a hurry, and are and don't have the luxury of time and don't have the luxury of an unlimited checkbook. The places where innovation really happens is in those kinds of first or second generation companies. By the time you become a fourth generation company, you're all about scale. You're all about doing the things that those first and second generation companies can't do, right? Service huge numbers of people effectively, reliably, over and over again at massive scale. Startups don't do that. And I'm more of a startup guy. So learned a lot, have lots of great friends, learned a huge amount about consumers and what people and how to reach people, and then set about building the next company around all the hard stuff, all the hard work that still remains undone, not done, that hasn't changed for the past 2-3 decades in any meaningful, grand way.
And so that company, it was and is Cherish Health, correct?
That's correct, yes.
Awesome. And so moving on to Cherish Health, so during the COVID-19 pandemic, so Cherish Health kind of rolled out a biosensor for COVID-19 patients or those at risk for COVID-19. Yeah. Could you kind of walk us through how that all kind of came to play?
You've done your research really, really well.
It's borderline stalking.
All right. I wish I wish most people did their research this well. This is fantastic. So look, when I was actually sitting, 3 floors down in this building on the day that the world started shutting down, and as we started hearing about the symptoms of this disease, a couple of us sitting there realized that these biosensors that we had made in um, a prior life, all to again enable more care in the home. That's what we had built these for, to enable a hospital at home model of care, where hospital level care could be delivered in home settings safely with the kind of instrumentation, with the kind of telemetry that you would have in a hospital, but low cost, ubiquitous, easy to deploy, etc. We realized that the things that these biosensors picked up were the same things that were the symptoms of COVID. We could pick up to your temperature, we could pick up your elevated heart rate, your heart is working extra hard to pump blood through your body because your respiration rate is depressed because your lungs are not functioning properly and they're not getting enough oxygen, right? That stuff we could detect with these biosensors. And what we realized was that if we put this in our data platform to service people who had been recently diagnosed with COVID, we could help them in their own homes and prevent the spread of the disease. B, we could take a lot of the overcrowding and capacity utilization problems that we later started, experiencing. Hospitals basically canceling elective procedures, making beds become open just for COVID patients. Recategorizing their services around COVID wards and so on, that we could actually take care of a lot of those patients safely at home, without them needing to go into hospitals, freeing those resources up, freeing up staff time to take care of people who were actually now being told, hey, sorry, we don't have time for you. People were still having heart failure, people were still having all the conditions that they needed to be in hospitals for, but hospitals didn't have beds for them anymore. And so we said we could go solve that problem at scale. It's really interesting that when we started hearing from people in other countries who had started seeing what we were doing, the speed at which this technology got adopted elsewhere was even faster than it was here. And we wound up launching our technology and wound up going into markets in other countries probably 2-3 years sooner than our business plan called for. And so this entire period, on the one hand, very quickly got us into a mindset of can do problem solving. Let's go figure out what's needed. Let's go do this really quickly. Let's go make it as safe as humanly possible. Let's go help people. That was one. Two, our business plan got accelerated massively. Our data platform got tested in the real world probably a year earlier than it would have been. Our wearable biosensors got deployed as standalone products, as opposed to being deployed as an accessory to what we're building. The business plan shifted very quickly, and that's actually very much the DNA of my team. We've been together, some of us, across the past 3 companies. We all know what each other's superpowers are. We all know how to work really well together. We know what our swim lanes are. We know what we're great at. We know what we're not great at. And so we were able to just take all of that stuff and turn on a dime and go put this out very quickly, and start testing it in the real world with real folks who wanted to validate whether this worked. We found beta customers. This is another big challenge in healthcare, being able to move fast with a healthcare customer, with all the regulatory things. There's always when you try to move fast in healthcare, there's always what if something goes wrong? What about liability? What about privacy? What about consent, these topics basically become the dominant conversation. After you've solved all the other problems, these still become the thing. Oh, by the way, how do we get paid, right? Those topics, no matter what you do, become the topics. And it's really interesting that in the middle of COVID, those were the topics. Healthcare organizations were still dealing with, can I see the data in my medical record, rather than how can I very quickly get hundreds of people into a safer mode of being helped. All that stuff boils down to, again, misaligned incentives, but it launched us very quickly.
And are you still, you and your team and Cherish Health, are y'all still launching, essentially still on that upward path, or has it kind of slowed down a bit?
Oh, there's no slowing down. We're growing, we're hiring, we're building the technology that is at the heart of what our business plan is. We're building that harder, faster than we ever have. This just took care of a bunch of things much sooner. When we launch this device that we're building, we will have the luxury of launching it without also having to launch all the things that it needs to operate. Those things are already launched. And so, as I said, our business plan got accelerated. Our real world deployments of our technology got accelerated. We were able to find issues, bugs, ways of working that we hadn't thought about. We were able to find all that stuff a year before, the heart of why Cherish exists is going to launch. And so when we launch that, we'll be able to focus on it and making it succeed without having to worry about 3 other or 13 other layers of technology and services and ways of working and service delivery and logistics and all that.
Yeah, that's awesome. I think right now I'm going to open it up real quick if anyone else has a few questions, given what Mr. Nagpal has told us. If not, I'll continue on with some other questions. Okay, cool. So one of the things just kidding. So one of our club event attendees mentioned, what are the biggest challenges you face with scaling up in time of COVID?
Well, it's interesting. I say this now on a regular basis, that what we found in healthcare, Cherish is not just about healthcare, and most of our clients will not be healthcare customers. We're selling directly to consumers. And what this pandemic taught us about healthcare, it just reinforced what we've learned, that healthcare has a really hard time scaling up as an industry. It takes, depending on whose statistics you want to believe, although we've seen this massive counterexample with vaccines, right? We got vaccines from 0 to in people's arms in a year. In general, it takes 16 to 17 years for a piece of innovation to make its way from an idea to the real world where it's commonplace, used every day. These vaccines, one thing to remember is that they came to market this rapidly because they built on things that had gone through years and years, in some cases decades of trial and error and validation and so on, right? So in general, healthcare takes a long time to scale up. And in the time of COVID, the interesting thing about our industry is that even a pandemic didn't make us go any faster. That's really interesting. We didn't change how we work. We couldn't scale up. We couldn't adopt new ways of working. We couldn't do things faster, better, cheaper. even with a pandemic staring us in the face. That's interesting. I hope that answered, at least, maybe that's not the answer you were expecting, but I hope that gave you an answer.
Awesome. So I'll move on to the next question then. So in terms of your personal opinion, what is your ideal 5-year outlook look like for yourself, for your company, Cherish Health, and then for just the overarching healthcare scene in the United States?
So, 5 years, again, I go back to the comment I made about what I saw in healthcare 2000, right? In that video, there are things that they dreamed of that are still not ubiquitous. There are things that I dreamed of in 2003 in a prototype that still don't exist. And yet something else is happening, which is because of the kinds of technologies that are becoming commoditized and becoming affordable and becoming available to consumers themselves. Because of the internet, because of social media, because of people being able to reach their customers directly, we're starting to see the momentum build for consumers to be able to start making choices about where they buy healthcare services, how they live, their lifestyles, especially when it relates to their safety and well-being. People are more and more being able to make those choices, especially as what has happened over the past many years, high deductible health insurance has kicked in. People are paying out of pocket. They're really aware that something is going to cost them money out of their own pocket. That's making us make choices about how that money is being spent, right? The right consumer behavior is being driven by some of these factors, and access and commoditization of digital technologies is giving us the ability to go buy stuff ourselves that used to be just completely off limits. You couldn't walk into a Best Buy and buy some of the things that today you can just walk out of there and start monitoring yourself, and start seeing how you're doing about things, or start working on a problem you want to solve yourself. And so I think what will happen because of these kinds of factors is digital technologies, digital tools, combined with services that are coming straight to you, that are aimed at helping you as a consumer solve problems you're struggling with. I think that is going to become just a huge leading edge of change in healthcare. That's one. Two, I think because the people who pay for expensive procedures and expensive hospitalizations and expensive emergency room admissions and expensive ambulance rides and so on, because those people, whether they're employers, whether they're self-insured employers that insure their entire populations themselves, whether they're health ministries, paying for a population's healthcare expenditure, healthcare has become so expensive that people have run out of the ability to keep writing those checks. The tolerance for more and more expenditure has gone away. And so that, combined with consumerism, where people are not going to be willing to write those checks anymore to pay for the things that aren't delivering the kind of value that is expected or that should be happening. The value of prevention and maintenance rather than the value of a repair job, right? Those kinds of things are going to start becoming what these payers pay for. And that, combined with consumerism, is going to bring us into, I think, a whole new way of dealing with healthcare much, much faster because of these two factors. Commoditization of technology on the one hand, and we run out of money on the other.
Yeah.
Primary care is going to become a key force here, right? Primary care led care is going to become much more significant as we go forward, where your doctor, your primary care physician, will reach into your everyday life to help you stay healthy much more. And the team around them is going to go do more of that. Or you're going to be able to benefit from the kinds of things that primary care providers used to do by just buying something that helps you change a piece of your lifestyle, or change a piece of your behavior, or change a piece of your condition. Those factors are going to come together. And I think that's just going to accelerate this transition to what I like to describe as the logical endpoint of all of this, which is healthcare's coming home. We're going to become more proactive, more predictive to help manage safety, well-being care where people live. That's where healthcare is going. And I think the next 5 years will actually see real acceleration, real adoption of the kinds of tools, models of care delivery, where healthcare comes to you on your terms, where you are, rather than you go to healthcare on its terms and wait for it to get around to servicing you.
Yeah, that's great. I think the one question I have that I was curious about is, I'd say like the elderly and those with the lower socioeconomic status are, let's say they would most likely benefit more from having this healthcare at home monitoring, right, where they can prevent and maintain diseases if they have them. But on the flip side to that, I feel like this is a question we ask every speaker for a digital health series, is that those people, I guess, are they either don't have as much access to technology, or they may not be as familiar with technology. Is this a problem you've kind of had to work through with Cherish Health, or has this been something where you've actually like jumped over the hurdle and you don't see it as a problem?
So I'll start with the end, the summary answer first, then work backwards. I don't see it as a problem. I think that we don't give credit to people of all ages in how they're able to use technology, if technology is good and usable. The problem isn't frequently the people who are supposed to use it. The problem very frequently is either they don't have access to it, or the technology just sucks and is hard to use. And so, great user experiences, great human-centered design, taking the friction out of bringing things up. How many times will someone have to explain that if you're going to give grandma something that expects that grandma's got a smartphone and an iCloud account and can download an app and can type in and remember the Wi-Fi password or an account number and type that in, that you're going to have issues getting grandma online onto your solution. Like, take that friction out. Think about the user, think about that person's life, put yourself in their shoes, go solve those issues in a way where I like to say this to my team all the time. People don't wake up in general every morning to use the app that you're so in love with that you've designed or built. They don't wake up every morning to use your app 3 or 4 times a day. When people talk about patient engagement, I think that that's just a bogus phrase, right? What the hell does that mean? Why should I be an engaged patient? I just want to live my life, and I don't want to be reminded all the time that I'm sick, or, don't make me work extra hard just because you've got an app. I don't live for you as a consumer. You're there to cause something to happen for me that I'm willing to pay for, or that someone's willing to pay for, that helps me. But it's not my obligation to work for you. Make it as simple as humanly possible so that it gets out of my way and I get what I need. One of the other things I like to say about this is that when we implement things in healthcare that require behavior change, we are doomed to fail. People don't change behavior easily, and people don't change behavior sustainably over time. Don't build things that expect people to change behavior. Build things that work despite the fact that people won't change their behavior sustainably over time, and you'll win, right? So that kind of thinking is where I think the problem that you've laid out, which is, elderly, frail folks aren't tech savvy, or people with low socioeconomic conditions living with poverty, or living with, access challenges around technology. That second one is actually harder to solve than the first. The first is solved with great design. The second one is solved by recognizing that if we want to save money, we better go solve this problem about access. Because when people get sick, money gets spent. Let's get ahead of that problem. When people don't have access to the things that they need to remain healthy, to remain safe, all sorts of bad things happen.
Yeah, that was a great response. Very strongly put, which is, to be honest, not something we hear too much in healthcare. A lot of people like to kind of, dance around and say this, that, and the other. So I guess
apologize. I'm going to carry my laptop into the other office because that's where my power supply is, and I just noticed my power is battery draining. So please keep going.
Sure. So I have one last question before we open it up to the audience. If you could offer one piece of advice to an undergraduate student who's interested in being a nurse, a healthcare consultant, a research scientist, a doctor, or a software engineer for a healthcare company, what would that be?
Been thinking about that a lot. It's something that I try to communicate to people who join my company, people who join my teams, people I work with. Actually had more and more of a reason to think about this. Recently, it all boils down to one thought. It's all about question the status quo, question authority, question how things are if they don't make sense, question it. We're all, especially in healthcare, brought up to be incredibly respectful of how things are and how things are done. And I used this word yesterday as I was having this exact conversation with somebody on my team. We're taught to genuflect to people we're supposed to look up to, respect, people who've accomplished big things in their lives. We need to think about when we do that. We need to be really very aware that we're doing that. And we need to understand why we're doing that, because sometimes how things have been done forever isn't actually how they should be done. And the only way we're going to break out of the patterns that we are in this industry is by actually saying, hey, that's not okay. Or, hey, there's a better way. And hey, I'll actually give you an example. A very close friend of mine in the UK. First demo I ever gave many years ago. First time I went to the UK, did a demo in Leeds of a system I was building that pulled patient data together from a lot of places. And there was an academic researcher in the room who'd just done their demo, and he painted a picture of a roadmap about all this stuff will become real in over the next 10 years. A very academic way of describing how important the work is and how beautiful the work will be, and paint a picture for 10 years of what it would take to get there. And then I did my presentation, and I'm always in a hurry, and I'm always looking to to solve things in the here and now that can be solved in the here and now. And after that, this gentleman in the audience, who's grown to be a dear friend, got up and asked the first speaker, this question. So, you painted a picture of 10 years. Who's going to look after us now? Right? What about us now, right? And that's the thing we always forget in healthcare, that they're real people, our moms, our dads, our grandparents, our kids, us, here and now, who actually deserve better in so many cases, and who should have more access to safer, more convenient, more accessible care, and should be able to prevent bad things from happening more frequently than dealing with the consequences, just because the system's built to deal with the consequences rather than the prevention, because of how the incentives all work. Question that. Be in a hurry. Be in a hurry.
Yeah, that's awesome. I think I speak for a lot of us when I say that I have not heard someone say be in a hurry. But in healthcare, like you said, it's very slow moving. So that's awesome advice. Cool. So I'm going to open it up to the audience. I think we have time for maybe one question, maybe two.
I can start. Hey, Mr. Nagpal, thank you for spending the time and talking to us. I think going back to the previous question about care at home. So, earlier in 2020, CMS really emphasized bringing, this post-acute and even bringing like acute care into the home. Like the Hospital Without Walls initiative.
Yep.
And that's carried over, even later last year. A lot of funding and a lot of health systems have jumped on this bandwagon. So do you see, Cherish going in that direction at some point as, possible solution provider, as, the money seems to shift this way?
So I'll give you two parts to that answer. Is Cherish going into to enable support care in the home? Absolutely. It's the heart of what we're doing. Is healthcare shifting to that model in a hurry? Absolutely not, because there's so much infrastructure built up to do things not in the home. What do you do with that? How do you change these giant organizations that exist to bring you to those places, right? And so I think the challenge will be speed, not it's a matter of, when, not if, and the when is going to take longer than we want. And yes, Cherish is absolutely devoted, committed to helping accelerate that.
Got it. Yeah, that helps. Thank you. Appreciate that.
I have a quick question. So you've had the opportunity to do so many cool things, and I think like hearing about them all was like super inspiring. But do you have one that's like a favorite for you, or that like has really left like a big impact on you?
Wow. Well, so actually the example that I gave about that moment in Leeds was really quite profound. I was, this gentleman is, I think he speaks for all of us when he had the courage to stand up in a room full of doctors, in a room full of people who were okay with that 10-year timeline, and say, wait a minute, what about us right now here? Pay attention. I think that was a really profound moment. And then, I derive a lot of inspiration from people like Steve Jobs, people like Elon, who have just shown up and shown the way to reinvent entire industries. There's so much amazing stuff that has come out of those minds, and the world is just totally different. because of them. From an inspiring moment perspective, you just have to watch. I'll give you another example. The fact that SpaceX blew up 3 starships one after another and didn't call that failure, call that success, call that hey, that was fun, let's go do it again. We learned a lot. Next time we're going to do it better, and next time we're going to, and 3, 4, or 5 times in a row, maybe we'll get this thing to land properly. That's how progress happens. Fail fast and iterate. We don't do that in healthcare, but that's how we're gonna go solve big problems and take on big challenges and actually take care of people in the here and now, right? That's how we're gonna do it. I didn't answer your question very directly, but I hope that was an answer.
No, it was great. Thank you.
Awesome. I'm going to pull up the presentation now, and we're just going to finish off the event. Sorry for going over. We might go over a few minutes. All right, Elisa, feel free to take it away.
Awesome. Yeah, so I think everyone here has heard about the Husky Health Innovation Challenge, our case competition that is this March, getting kicked off this Saturday. So registration closed yesterday, and we're super excited to launch it for everyone. So if you signed up, just keep an eye out on your email from hhicinnovationchallenge@gmail.com. And if you didn't sign up but still want to be involved, we will be having our pitch day on March 27th. So that will feature our sponsors, including AARP Innovation Labs, Accenture, Johnson & Johnson, Trinity, a variety of colleges which is within Northeastern, the Mass Health Institute, as well as networking with students from a bunch of different schools across the Boston area, and an awesome keynote speaker from AARP as well. So. Cool, I think I can hand it off to the next person.
Awesome. Yeah, so just a quick rundown of our upcoming events. So on March 18th, we're going to have a ViTAL Meet the eBoard chat. So that's essentially all the eBoard members are all going to be on a Zoom call. And if you want to join and talk to us about what we do at ViTAL, outside of ViTAL, and if you want to join the club, like as in applying to the eBoard, all of that, we can talk about it then. And then we have a collab event with NU Impact. So the health tech and fintech collab event on March 25th. So that's 2 weeks from now. And we are going to be hosting multiple industry leaders who work in the health and fintech spaces. And then as Elisa just mentioned, we have our HHIC pitch day on March 27th, which is a Saturday. And so while the actual presentations themselves are going to be closed door to kind of mimic an actual business case presentation, we will have open portions of the event. And so feel free to stop by and network with our sponsors and hear the finalist pitches. I might be wrong there. So yeah. And yeah, thank you for joining us today. We hope to see you at our next events. These are our social media handles. Feel free to scan the QR code. And yeah, thanks for coming. If you have any other questions, Mr. Nagpal, would you like to stay on for a few minutes after? I know it's late.
Sure, I'm happy to stay on.
Awesome.
And I'm also happy for you to distribute my contact information if anyone needs to reach out. Happy to.
Thank you.